Hello everyone, welcome to this interesting part of our syllabus where you are going to prepare about seminar of management of hearing impairment. To help you, I am going to introduce you four main items could be included in your seminar. These four main items should be included, and of course it can be increased according to your convenience. What are these parts? Can you guess what is it? Any other suggestions? Okay, let us see. First part, we need to know what are the types of hearing loss. Through the lecture and through the book, you are going to know what is the first type. Exactly, conductive. Second and third, yes, I hear you. Sensory and neural. So the fourth type will be mixed. Could be conductive plus sensory hearing loss. Another part in types of hearing loss, you need to mention what is WHO classification for different types of hearing loss. This is mandatory, has very clinical implications. Another type of hearing loss, there are special types of hearing loss. In your textbook, Uncle Dengra, you are going to find special types, something like sudden sensory hearing loss, something like noise-induced hearing loss. All of these types, it must be known. It has its implications in clinical practice and in the way to approach it. Okay, so first type of your seminar should be covering types of hearing loss. First components, types of hearing loss. Okay. Second part from your seminar will be what is the epidemiology of hearing loss. It's a very important issue. That's why we have seminar about hearing loss. Epidemiology is very important. What is the prevalence of hearing loss here in Malaysia and worldwide? Okay, so under prevalence, what we are going to know further than that, what is the impact of hearing loss on quality of life? Another factor we need to address, which are the risk factors. Of course, what are risk factors? Yes, exactly, as you mentioned just now. It's noise-induced, noise exposure to hearing loss. Patients who are working in airports, in mechanics, in jazz, as very loud music, exposure to very loud music for a long time. All of this one lead to inducing hearing loss. So, first is types of hearing loss, which we mentioned just now, epidemiology and the implication of epidemiology. What will be the third type? What do you think? What do you suggest? Yes? Yes, exactly. How to approach for patient. You have patient come to the clinic with hearing loss. How to manage the case? First, you must know history taking. In history taking, you must identify. History taking means you are taking age, so you must identify what is the common diseases expected to be congenital, which is acquired at young age, acquired at adult age, acquired at old age. History taking, including not only this one, including family history. If this family has exposure before to hearing loss, have patients with hearing loss and so on, is it familial sensory hearing loss or not? Social factor, what are hobbies, what is the job, what is the occupational, as mentioned earlier. So first is history taking in the approach. Second is physical examination in the approach. How we are going to do physical examination? Just to try to identify. Of course, this will be clarified in our CSL later on. So, how to approach a case? First thing is history taking. Second part is physical examination. Third is investigations. As it was mentioned in deafness lecture, I would like to concentrate in two things. These two things are very important, very implication in clinical practice, very important in your real life, and very important in exit exam. To simplify, investigations are two types: subjective and objective. What you must identify, how to interpret the audiometry. That's subjective test. Objective, tympanometry. How to identify the tympanometry. What are different? How to identify different types of hearing loss in audiometry? Tympanometry is about compliance of tympanic membrane. So it's very important. It gives an impression about the status of middle ear. So that's why it's very important, very practical, very useful. So that is how to approach the case. Know what is epidemiology of the case. We knew earlier what are types of hearing loss. So what do you think is the last part of your seminar should be? Yes, exactly. It will be how to manage the case. Whatever the case is, you need to manage. Actually, basically, we have three approaches. One is medical treatment, one is surgical, third is rehabilitation. Also, to simplify in very simple words, medical treatment, patient has otitis media, you can use medication, ear drops, systemic antibiotics, systemic decongestant, whatever. All these one are medical treatment. Patient have middle ear effusion, you are going to drain the effusion. Coming to surgical, you can do surgery or you can do implantation. So surgical, like tympanoplasty and laryngoplasty. Here is the cochlear implant and bone conduction implant. Third part is rehabilitation, is how to apply hearing aid. You must be familiar with what are types of hearing aids. This is very important. Also rehabilitation, patient must know how to lip reading. This is very important. You must know what is the pros and the cons for each type. What is the implication? I hope you concentrate a lot of your presentation about this management. It's very important to know. So to summarize, for management of hearing impairment, you are going to identify these types, these parts, types of hearing loss, epidemiology of hearing loss, how to approach hearing loss, and how to manage case with hearing loss. This to be included in your seminar. Take care, this seminar should not exceed 2 hours. Meanwhile, there is some facts you must know from the start. First thing to know is the anatomy and physiology of external and the middle ear, and also of the inner ear. And here our concern is about the cochlear part. You must know physiology of hearing. You must know about sound magnification. How is this one? Because impairment of any this part will lead to different types of hearing loss. So that's very important. And finally, you must be oriented with the different types of hearing aid. So this one, which is post-auricular, this will be intercanal. So these different types of hearing aid you must know. You must understand our golden standard is behind the ear one. That is the preferable because it's easily to manage and meanwhile it's affordable. Okay, so this one you must know. No need to present in your seminar, but you must know it by heart. Everyone must know about it. So just not to miss my message, management of hearing impairment, the seminar must include the following items: types of hearing loss, epidemiology of hearing loss, approach of hearing loss, management of hearing loss. So I hope you will enjoy it and have a nice time. See you. Bye.